Good afternoon, everyone. My name is Morgan Gargiulo from the New England QIN-QIO, and I will be moderating today's webinar with the help from Carol. But before we get started, I'm going to go ahead and mute everyone's lines, so bear with me just 1 second.
The leader has muted your line. To unmute your line, press #6.
Alrighty. Well, thank you guys again for joining us for the webinar, The New World of the QIN-QIO and the HIINs. Before we get started, I'm going to go over a few housekeeping items. This call will be recorded for training purposes, and I'll provide you details on accessing the recording at the end of this webinar. As you know, the phone lines are on mute for the duration of the presentation, but we will be taking questions at the end, and I will provide you with instructions on how to unmute your line at that time. We do encourage you to post questions using the chat feature in the bottom right-hand side of your screen. When you do send a message, make sure to send it to all participants so that we can see it and keep up with all the questions that are coming in. So with that said, I'll pass it over to Carol to get us started.
Good afternoon, everyone. Thank you so much for joining us today. I am Carol Dietz, the Regional Lead for the Hospital HAI Reduction Collaborative for the New England QIN-QIO, and have the pleasure of introducing my friend and colleague, Danielle Hersey, who will explain the new work for the QIN-QIOs around the nation, which will be starting next month, actually in 3 days. Danielle is the New England QIN-QIO State Director for Maine and has been the state lead in Maine for the Hospital HAI Reduction Collaborative since the start of this 11th Scope of Work contract with CMS, which started in mid-2014. Danielle is a critical care nurse with a wealth of experience relating to reducing HAIs and building antimicrobial stewardship programs inside as well as outside the hospital walls. Without further ado, I would like to turn the microphone over to Danielle. Danielle, please take the presentation away.
Thank you very much, Carol. Let me begin by quickly apologizing for my sniffles. They are real and unfortunately not the result of a bad night. By way of introduction, Health Centric Advisors, in partnership with Qualidine, was awarded a CMS contract to do quality improvement work for all 6 New England states. Together, we are the New England Quality Innovation Network Quality Improvement Organization, or a QIN-QIO. To briefly explain our work, we provide free quality improvement consultation and resources for the following areas. In the hospitals, we provide support on care transitions, inpatient and outpatient quality reporting, as well as guidance on value-based purchasing. In the physician office, we support the Million Hearts campaign. We provide TQRS technical assistance and guidance around MIPS and macro. In the home health arena, we support home health agencies reporting in the HHQI, or Home Health Quality Improvement Database Registry for cardiac measures. And in nursing homes, we provide nursing home support on the quality measures, targeting efforts like reduction in antipsychotic medication administration, and projects aimed at improving the 5-star rating. And lastly, we do beneficiary diabetes education, or as we kindly refer to it as direct-to-Benny education. We stand for Diabetes Self-Management Program. This is in support of the Everyone with Diabetes Counts initiative. Our objectives for today are to identify opportunities to partner with the QIN-QIO to support your organization's quality improvement efforts, understand how your facility can participate in the new outpatient antibiotic stewardship collaborative, and understand the transition of leadership of the HAI collaborative to the HIINs. So, partnerships for patients. CMS's Quality Improvement Organization will incorporate key components of the Partnership for Patients through modifications to the QIN-QIO in the HIIN scope of work. The goal of the Partnerships for Patients is to sustain and expand national progress towards better care, smarter healthcare spending, and healthier people. As Carol indicated, this work begins October 1st. These modifications, the goal of these modifications are to notch up patient safety efforts. Patient safety is the core focus of both the QIO program and the Partnership for Patients. The Hospital Improvement Network will assume the work of the QIOs have been conducting with hospitals to reduce HIIs. The QIN-QIOs will now direct their infection prevention quality improvement expertise towards the implementation of antibiotic stewardship programs in the outpatient setting. This broadens the scope and boosts the effectiveness of CMS's HII initiative by addressing inappropriate antibiotic use in the community, which, if left unchecked, builds resistance to drugs that treat infections. The QIOs have a track record of proven effectiveness in improving care processes and outcomes, and the HIINs have demonstrated the capacity to support the majority of the nation's hospitals in multi-year programs to decrease patient harm. So the Hospital Innovation Improvement Network formerly was the HIIN, which is the Hospital Engagement Network. And the new HIINs will support current work of QIN-QIOs and the HIINs to reduce healthcare-acquired infections and decrease avoidable hospital readmissions for patients with Medicare. So, let me recap, because I think I stumbled through that a little. HIINs become HIINs, and HIINs will be doing the work of the HIINs and the QIOs. And if you've got that, give me a thumbs up in chat. This integration presents unique opportunities to accelerate improvement in more than 4,000 hospitals, expand infection prevention initiatives to thousands of outpatient providers, and further strengthen CMS's commitment to a healthcare system that delivers better coordinated care. Okay. So both of the HIINs and the England QIN-QIO have been offering education and direct technical assistance to recruited hospitals for over a year. This work has centered around catheter-associated urinary tract infections, C. difficile infections, central line-associated bloodstream infections. In this slide, and the slides to follow, we will look at some of the improvements demonstrated. This data is a current snapshot of the C. difficile rates in our region. There are 70 hospitals, approximately of them participating in this collaborative, with a cumulative SIR below the national SIR of 0.924. This demonstrates the hard work and commitment of the hospitals in supporting quality improvement organizations' efforts in this area. This snapshot should not be used as a comparison for state-by-state performance, as it includes a wide variety of hospitals, from large urban to remote critical access. For example, Rhode Island had 100% of their acute care hospitals participating, and that state SIR should not be compared to Maine, as their demographics are so different. Maine has a 50% participation rate, with half being critical access hospitals, essentially making it an apples to oranges comparison. So here is a snapshot of the progress done in 2 of our 6 states. When Connecticut began their initiative, they were struggling with their CDI rates, but are now sitting comfortably below the national SIR. In Mass, it is a slow and steady race towards improvement. So congratulations to those states for their commitment to reducing C. difficile infections. We look forward to seeing more progress as the HIINs focus on this work and with the support of the QIN-QIO. This CLABSI initiative has 35 participating hospitals. The low national SIR is the result of many years of hard work on central line-associated bloodstream infections. Again, through the hard work of the hospitals and their supporting quality improvement organizations and the state health service departments, the cumulative New England SIR is below the national. And again, here's a snapshot of some of the progress has been made for CLABSI. This time we're using New Hampshire and Maine's data. Maine had a tremendous decrease in their SIR, and in the New Hampshire graph clearly shows the ebb and flow of change, but shows a steady and sustained improvement for the last 4 months. Keep up the good work, Northern New England. And finally, here is a look at the catheter-associated urinary tract infections. New England has 62 participating hospitals, and the collaborative SIR lays well below the national. Again, here are 2 excellent stories of change. It should be noted that while Vermont appears to be trending upward, what is actually happening in that state is that more hospitals are reporting consistently and accurately in NHSN. Congratulations on the hard work, Rhode Island and Vermont. We look forward to celebrating more success in the future as this work continues. And on behalf of the New England QIN-QIO, we would like to thank all of you for your hard work and diligence on combating healthcare-acquired infections. It is wonderful to be a part of such a deeply committed group who believes the SIR should be 0. We are excited to partner with the Hospital Innovation Improvement Network to take HII to the next step as we work collaboratively to support the hospitals in all of their quality improvement efforts. Several months ago, CMS conducted a procurement to award multiple first-fixed price HIINs contracts. The contract should be awarded very soon. The contracts have a 2-year base period, and they focus on 11 core areas of patient harm. Those areas are listed on the slide, many of which were included in the previous 10 work.
Danielle? This is Morgan. Are you advancing the slides?
Yes, I am. Are you not seeing it?
We are not. We're still seeing you on slide 10.
Oh. I'm on
If you would like, you can pass me the ball. If you click on the little ball next to your name and drag it down to my name, I can try and advance them for you.
All right, you should have the ball.
Yes, I've got it. Okay, so, or is it
I'm just doing it. I'm not a person.
Yeah, I have it. Okay, we should be good.
Okay, do we have, all right, so we're on in areas of focus?
Actually, I think it was another person in our room. I think her computer has frozen. So actually, everyone's good and they can see. So I will keep advancing the slides for you.
Okay. Thank you very much for that. And that gave me a great time to take a sip of water. So that was great.
I'm glad we could help.
Okay, so both the HIINs and the QIOs will support the reduction of avoidable hospital readmissions. The HIINs will build on the previous HIIN activities that provide hospitals with education strategies and tools for effective discharge planning and communication with post-acute providers. The QIOs will also support improving communications by bringing hospitals together with nursing homes, home health agencies, and local organizations like Barriers on Aging to develop a community-wide approach to improving care transitions. In fact, there likely are several likely contract awardees that are participating in this webinar. I encourage you to introduce yourself in chat. Next slide, please. So the QIO changes for the acute care setting. The QIN-QIO will continue offering hospital support on inpatient and outpatient quality reporting, value-based purchasing, and as previously mentioned, care transitions. The QIO will expand work to include outpatient antibiotic stewardship initiatives and adverse drug intervention-specific projects. Next slide, please. As previously mentioned, the HIN and the QIN-QIO have worked collaboratively but also simultaneously on the same HAI reduction goals in the past. The objective of the new HIN and QIN-QIO relationship is synergistic, and here are some examples. The QIN is helping nursing homes reduce catheter-associated urinary tract infections, will contribute to fewer hospital admissions or readmissions, as well as to lower sepsis. Similarly, the HINs will do efforts to reduce adverse drug events in the hospital will benefit from the QIN's interventions with community pharmacists and physicians to improve safety for people who take high-risk medications. Our goal is for your hospital improvement activities to continue without interruption. The HIN and the QIN-QIOs will work together to ensure a smooth transition. Next slide, please. As we work on the HI reduction efforts in the hospital transition to the HIN, the QIN-QIOs will begin working on antibiotic stewardship in the outpatient setting. Antibiotics are the most commonly prescribed class of medication. At least 30% of outpatient antibiotic prescriptions are unnecessary. In 2015, the National Action Plan for Combating Antibiotic-Resistant Bacteria, or CARB, set a goal of reducing inappropriate outpatient antibiotic use by at least half in 2020. Overuse and misuse introduces greater risk of developing resistance and compromises effectiveness. In November 2016, the Centers for Disease Control will release the next slide, please. Again, in November 2016, the Centers for Disease Control will release the core elements of antibiotic stewardship for outpatient settings. Using multidisciplinary teams, the antibiotic stewardship program will allow facilities to monitor, reduce, and prevent misuse and overuse of antibiotics. The QIN-QIO will work with the outpatient settings to introduce and support the implementation of the core elements. Next slide, please. The outpatient settings include, but are not limited to, emergency departments, walk-in clinics, federally qualified health centers, and physician offices. Assistance includes free education offerings, on-site support, and guidance with the implementation of the core elements and ad hoc quality improvement consultations. There is no fee. Our organization receives funding from CMS to assist the provider community with quality improvement initiatives. Next slide, please. If your organization would like to receive assistance developing their outpatient antibiotic stewardship program, please contact the state lead listed below or myself. My email address is located at the beginning and end of this presentation. And as always, please do not hesitate to reach out to us about your quality improvement needs. We are here to support the good work you do every day to keep patients safe. Next slide, please. These are some of the resources used to develop this presentation. It has the National Action Plan on the antibiotic stewardship. It has our New England QIN-QIO website, which has a lot of resources across the care settings. Also has links to our previous recorded webinars and learning events. And then there's the Partnership for Patients website as well. And next slide. So that went quicker than I thought it would, and I'm sure there are a lot of questions. So at this time, Morgan, can we open the line for questions?
Sure. If anyone on the line has a question, please press #6 to unmute your line, and then make sure you didn't also manually mute your phone line in the beginning. Again, that's #6 to ask a question.
Good afternoon. Oh, go right ahead.
Hi, this is Suzanne Bashon from Southern Maine Healthcare. Can you hear me?
Absolutely.
All right, I have a question for you in regards to getting help from the QIN in regards to antibiotic stewardship. What type of education is provided? Can you give me an idea of what would be some of the work that would be done, or what the work that would be what help would be available?
Hi, so Susan, it's Suzanne, right? Not
Suzanne.
I knew I was missing something. I'm sorry. The Southern Maine
Healthcare. Mm-hmm.
Okay. So the antibiotic stewardship education, we would be formulating some online learning opportunities, pulling resources from within the 6 states to that of content experts to discuss these programs, so that we always will have online learning available to anybody. The participating organizations that work with the QIN-QIO and the antibiotic stewardship would receive the on-site consultations and support to implement those programs. So we will quickly, as soon as the CDC releases those core elements, we will do a deep dive into them, extract the information that's going to be most beneficial, and get people on the road to success with that program the fastest.
Okay, thank you very much.
Again, it's #6 to unmute your line.
Hello.
Hi, go ahead with your question.
Hi, this is Kim Knox from Milford Regional Medical Center, Milford, Mass. And we've been doing a lot of work with the antimicrobial stewardship here, so a good primer for the group to use prior to getting the program developed would be antibiotic stewardship in acute care, a practical playbook, which is from the National Quality Forum, and I think they'd find that quite beneficial.
Thank you, Kim. That is an excellent suggestion. We have all speculated that the outpatient core elements will be similar to the inpatient guidelines, that the fundamentals of an antibiotic stewardship program would be the same. That being said, we'll all enjoy seeing what they have actually put paper to pen.
Yes, and I'm sure there'll be some slight changes in outpatient versus inpatient. However, I think the support of the stewardship will be the same in terms of appropriate use, educating the public about, effective use of antimicrobials. I know we started at our hospital by putting in our patient guide, information from the CDC and gets out about the antibiotics, so it tells individuals about viruses versus bacteria when it's appropriate to use antibiotics. And also we have other elements of education going on, so that part of it is going to be public awareness so that there's pressure taken off of primary care providers for ordering antibiotics inappropriately. And also, I think in some of the settings that are not inpatient settings, not acute care inpatient settings, but outpatient acute care settings, there's some excellent literature out there also from CDC, which focuses on even things such as when it's appropriate to test and treat for urinary tract infections, because some of the individuals would be colonized. And, if they're asymptomatic, of course, we don't want to initiating antimicrobial use for those individuals.
So, Kim, that sounds fantastic. I will tell you, I was having a little bit of a hard time hearing everything that you were saying to me. But one of the, as we get going with this. A great opportunity. It's always to partner and highlight some of the work that's already been done in the outpatient setting. Kind of to tell the story of, success and people who have done some early implementation that may be of great assistance to people as they look at working on this initiative.
Hello.
Hi, go ahead.
Hi, this is Nancy Murphy representing Bridgeton and Armford Hospitals in Maine. I was interested in finding out, you had talked about the HIIN-QIO, about either some pre-done packets or tools for discharge planning to decrease readmissions.
Hi, Danielle again. Sorry about that. We would love to meet with you to talk about the discharge planning. I do not have on my fingertips what the HIINs were giving out for that information, but we can certainly reach out to them and see what they have and try and get that to you. And regardless to that, like I said, we would love to come in and meet with you and see what your needs are specifically.
Terrific. And will you be at the MHA quality meeting, the next one?
Yes, I believe, yes, we will be.
Okay, then I'll see you there.
Okay, sounds good, Nancy. Thank you.
Thank you.
Any other questions? Again, it's #6 to unmute your line.
Well, this is Carol Dietz. Danielle, thank you so much for that wonderful presentation about the new world for the QIN-QIOs around the nation and the HIINs working together. Moving our hospital work over to the HIINs, I should say, and with the HIINs to continue to support the hospitals in this very important work to keep our patients safe, and that's the bottom line. So with that, we're going to end our session. So Morgan has a couple more housekeeping tips for us.
All right, thank you guys. As you close out of this webinar, an evaluation will pop up on your screen automatically. If you could fill that out, we'd greatly appreciate it. If you don't have time to do it right now, or you are sharing a computer with somebody else, you will receive an email in the next few days with a link to the evaluation as well as a link to the event page on our website. You can currently find the PowerPoint presentation for today loaded on our website, and within the next few business days, a transcript and recording will also be added, and you guys get a whopping 32 minutes back in your day. So thank you for joining us, and we'll talk to you soon.
Have a great day, everyone. Danielle, excellent job. Thank you.
The weather has disconnected. The conference will be terminated in 5 minutes.